afternoon, everyone, and welcome to this meeting of Perth and Kinross Integration Joint Board. It's an additional meeting, and you're all very welcome. We have one or two people here for the first time. Sandy, this is your first time at the meeting. You're a new representative on the board. You're very welcome. I hope you enjoy your time, your participation on the IJB. And Councillor Bailey, this is your first time also? Yes. Yeah. You're very welcome. Is anyone here for the first time? Stuart. You are as well. You're very welcome. As is everyone else. And do we have apologies?
Yes, Chair. We have apologies from Councillor McDade, and as Councillor Bailey is indicating, he's substituted. Also from Professor Nick Beach, from Lorna Burr-Stewart and Gillian Costello. And we also have apologies from Jim Fowlis, Dr. Alistair Noble, Claire Gallagher and Linda Lenny as well.
Thank you very much. Could I just remind everyone that the meeting is recorded? So if anyone here feels the need to go back and see it all again, please do. But it has been recorded, and also if you have a mobile phone on, or you have one, could you put it to silent, or any other devices to silent, or even switch them off if you'd like to do that. Before we actually start the business, could I apologise for the lateness of the papers? And they were very late, and I do apologise for that. It's not something that we would obviously want to happen. I think in the circumstances, you know, there's a lot of work was going into, particularly the paper with regard to the finances, the budget for next year and the subsequent 2 years, and up until the last minute, you know, in terms of discussions with NHS Tayside and Perth and Kinross Council to ensure that we had as accurate information as possible into the paper was part of the reason for the papers being a bit delayed. But most of us did have the benefit of our briefing session last week, so hopefully that was helpful when you did receive the papers and helping you to go through those more speedily than perhaps would have been the case. Are there any declarations of interest? No? Okay. Which moves us on to our first paper, which is an update with regard to the strategic commissioning plan for 2019 to 22. And we have a paper just outlining a proposal to take a bit more time to develop the plan. Rob, would you like to expand a bit more on that?
Thank you, Chair. Yes, we have been working to a plan that started in 2016 and was due to be refreshed by March the 31st, 2019. However, in recent weeks and months, there have been a number of factors which have come together to ask us really whether we're ready to provide that updated strategic plan. And our conclusion was that we would benefit from a delay to producing this new plan. The paper sets out a number of reasons for this. We have an updated strategic plan from the Health Board, Transforming Tayside, which is undergoing some developments. There is a strong interdependency, obviously, with that, and Perth and Kinross Integration Joint Board. Since we have the Perth and Kinross offer in development as well, there are increasing connections with other elements of the Council's work, particularly housing and the environment, and also with education and children's services, as we look forward to a greater connection with those two parts of the Council's service. Finally, we have a new Chief Officer who's starting on the 1st of April, and it's going to be very important that he is able to shape this plan. So I took some advice from the Scottish Government, and we will not be alone in Perth and Kinross if we delay our new plan. And what I'm asking today is that the board would approve continued operations under the existing 2016 to 19 plan to allow the IJB and to allow the Health and Social Care Partnership to proceed with its implementation of measures to meet that plan. And you'll see later today, as we discuss the Older People and Unscheduled Care paper, that the themes are essentially the same as we move forward. So my request of the board is that we would delay the refresh of the new plan until the IJB on the 27th of September 2019.
Thank you, Chair. Yeah, I totally endorse, as I think discussed at the previous IJB meeting, that we should take our time to draft this important document. Can I just ask that there be an interim update at the June meeting, rather than just go straight from where we are now to a final version in September? Perhaps there should be a discussion in the interim.
Councillor Purvis?
Oh, sorry. No, I'm just happy to agree with the recommendations to delay this until later on in the year, given some of the concerns that were raised in the last meeting. I think that there are some key points that Rob has highlighted about transforming Tayside, the Perth and Kinross offer, and also some of the outcomes of the Audit Scotland report and the Ministerial Strategy Group's recommendations, and also a new Chief Officer, which are good justifications for this. I think that doesn't necessarily directly address some of the concerns, while they're all valid, that we raised at the last meeting about the board members' involvement in this, given the board members' role to give strategic direction for the Integration Joint Board. And as I say, while those are all legitimate, and while I appreciate the fact we now have a draft copy issued last week, which we were able to have a look at, I still think that we need to have a commitment that there will be meaningful involvement and engagement with the board members about what we see as the direction for the board going forward. So whether that's through workshops or briefing sessions, or however, whatever form that takes, but that must happen. And the board members, whether they be voting, non-voting, stakeholder representatives, all have to be fully engaged and sign up to the plan that we agree later on in the year. So with that proviso, and perhaps Rob, you could maybe outline if there are any things that you would be happy to commit now to doing, I'm happy to agree the recommendation.
Thank you, Councillor Purvis. Yes.
Sorry, Rob.
Sorry, beg your
maybe
pardon.
on the
Okay, thank you. And it may address the points that Councillor Purvis is making. I fully agree with you, Councillor Purvis, that it's imperative the board actually set the strategic direction for the Health and Social Care Partnership. My recollection is that at a previous meeting, Councillor Stewart, you suggested that we should do a workshop, and I thought we had agreed to do that in terms of setting out the strategic direction of the Health and Social Care Partnership. So I think that the key here is having a workshop to actually set out what the strategic agenda, what the results and impact we're trying to achieve for this Health and Social Care Partnership, and actually how we're going to engage those who will be impacted most, and that's people across Perth and Kinross that experience care. So I think that is absolutely the way forward.
Thanks very much for those comments. Rob, is there anything you would like to say?
There's nothing I need to add to what the Chief Executive has said. Thanks very much.
Okay. Thanks very much for those points that have been raised, and we'll ensure that we get a date as early as possible to engage with the board members and thereafter look at the process of full consultation with people who, as Karen has described, are impacted upon by the services or require the services of the partnership, and ensure that reviews are incorporated into the new plan. And also, as Councillor Drysdale has suggested, that we receive a report in June to hear of progress with regard to the progression of the plan. Are members happy to accept the 3 recommendations within the report with those additional points that we've just noted? Yeah. Okay. Thank you very much. Which moves us on to item 4, the Older People in Unscheduled Care Strategic Delivery Plan. I have a report from Dr. Dougal. Would you like to tell us a bit of the detail of the plan?
Yeah, you've got the plan in front of you, and we had quite a lot of discussion about the detail of it at last week's development session. Probably the key elements that we discussed and that we'll probably pull out from it. Well, first of all, to say this is still progressing in development, and this will be part of the final strategic plan that we come up with in 2-3 months. But the key areas of development would be the enhanced community support, which is about supporting patients close to their own home and preventing unnecessary hospital admissions and getting patients back into their own home environment as early as possible, which is what patients and service users would like. So in order to do that, we need a significant enhancement of our current support within the community, predominantly around occupational therapy and physiotherapy services, but not other services as well. The second or more specialist area is that of respiratory care. We know that respiratory reasons are the highest reason for admission to hospital. For acute admission, they bring significant morbidity and discomfort to patients. So we're really investing in a level of service which is seen elsewhere in UK and in Scotland, which really supports patients, keeping them as well as possible at home, is something we see as a priority as well. In terms of our rehabilitation community model as well, making sure that the services and the beds for rehabilitation are where they are most needed and they reflect the population needs is another key theme in that. I probably don't want to bring out too many more details in it, but I'm happy to take questions.
Thank you very much. Are there any comments or questions anyone has? Kat.
Can I just ask you on home care, respiratory care? Is it switched on? Is that better? Yeah, thank you. Does that involve monitoring of, like oxygen provision and home monitoring of respiratory care? Are you contracting with providers, or how? It's not just respiratory nurses, is it?
So at the moment, the home oxygen delivery is a service which is well established. This is about supporting patients to have anticipatory plans, step up, step down plans, supporting them at home so that they don't immediately go into hospital.
Sure.
And they can be cared for more at home. It's likely that the majority of this will be specialist nurses who will be working in the community. There are specialist nurses who predominantly are focused in the hospital, and we would see an important of developing this going forward is about having a joined up design with this, with our secondary care respiratory colleagues, with our existing respiratory teams of nurses, also our community GPs and respiratory nurses within practices, and also getting learning from other areas both in Tayside and around Scotland where this is working well. We want to get a really good service here for patients. It's something we've not invested in the past. It's something which I think there's a clear need for. So I think it's a really transformational proposal.
Any other points?
Thank you, Chair. If I drew Dr. Dougal's attention to just the introduction, the delivery plan development, the work that's gone around the shaping of the strategic delivery plan here. We've got mention of the 3 workshops held in autumn of last year, and then feedback from public consultation. I think you're at the right place. Yeah, just checking. Sorry. The feedback from the public consultation. What I would just like reassurance around is that the public partners, the service user partner, the care public partner, potentially the third sector representatives, either the ones from the IJB or other public partner representatives, were they actually engaged in the workshops and the development of the plan, or just in feedback from public consultation? And I was just wondering which public consultation. I mean, there's obviously sort of ongoing public consultation, but was this a specific exercise, and were there outputs from that public consultation exercise, or how was that public consultation conducted, and how was it reported and fed into?
So this relates to the consultation and engagement, and the workshops relate to an NHS Tayside public consultation, and the workshops relate to the NHS Tayside work that's been taken through the Older People's Board. In relation to ourselves, we will be entering into consultation and engagement at locality level in relation to the direction travel.
Okay, thanks very much. And I think I mean, I know that this is a draft of the strategic delivery plan, and obviously the recommendation is that a further iteration comes back. So I think it's good for the board to be able to input into some elements here. I think that the development at the back of a list of much more specific actions with deadlines, people's names against them, in terms of actually attempting to achieve certain targeted strategic outcomes is a welcome development. I think I would just maybe like to feed in at this point that in terms of the performance indicators, in terms of the measurability of the outcomes, we're sort of indicating how we might measure the outcomes, but not what a starting point and a target to achieve is. And I think actually setting ourselves a goal, an ambition that we are, you know, we're documenting the measure of what measure we might use, but what level within that measure do we want to actually achieve, and actually setting targets, specific targets within the strategic delivery plan would be a good development as well.
Yeah, I entirely agree.
Thank you, Chair. It was just to pick up on the point that Councillor Stewart was making about the measurability of the targets. Obviously, as we had at the last Audit and Performance Committee, we had the first performance update for the Older People and Unscheduled Care Board, and it was good to get feedback from board members, those committee members, as to some of the information that they might like. So I hope that once we get the further draft back, and that will inform the future reports, because although the original report was quite detailed, there's still a lot of information that could come in terms of strengthening the Audit and Performance Committee's role of looking at performance, and perhaps we could feed into that process as well, to make sure that the information that's coming back is actually usable and will actually give us information that is going to help monitor the performance going forward.
Thank you, Chair. Thanks for the report, Dr. Dougal. And I just wanted to pick up on one particular action that is set out in the table at the end of the report, which is around enabling housing and accommodation solutions to support older people longer in the communities. Having attended the last IJB meeting and heard Claire Mailer's report, and again having heard it at the Housing and Communities Committee meeting earlier this week, I'm delighted with the progress that is being made in this area, and it's an exemplary part of the Council's activities. There's absolutely no doubt about that. I'm just wondering, therefore, given that particular aspect of health and social care integration is comparatively far advanced, I'm just wondering why we're showing a target date of September 2020 for measuring this. Can we not be making quicker progress in this particular action?
Thank you, Councillor Drysdale. This is an area that's currently under review. Myself and Claire Mailer are working very closely in developing options around older people's accommodation. So that is something that we will absolutely review and bring back a further date in the next IGB.
Thank you. I think it's very important to recognise. I think that this is a really, really important aspect of the work that we're doing. Thanks.
We have two recommendations. The first was to note and support the progress towards the development of the delivery plan, and second, a request that we receive a further update of the plan for approval at a future meeting. Is it possible to be more specific about a date that this would come back to us?
We were just discussing that earlier. I think it's June is coming.
June?
Yeah.
Okay. Are members happy to approve these two recommendations? Accept the recommendations? Okay. Thank you very much. Which now moves us on to item 5, which is a paper on the Core Health and Social Care Budget 2019-20, 2021 and 21-22. as I indicated earlier, a number of us had the benefit of a briefing session last week, which was very helpful in terms of going through the detail of what is now in this report. And I'll ask in a moment Jane and Callum if they would like to kind of say a few words with regard to the paper today. Before I do that, I'd like to thank Jane and her colleagues for all the work that actually has gone into kind of getting us to this stage. I think Jane in particular for the effort she's made to actually pull all of this together, for the support that's been provided by finance colleagues from Perth and Kinross Council, and also the engagement of finance colleagues from NHS Tayside, which is, I think, now bearing more fruit in terms of that engagement and helping us to kind of see a way forward for some of the difficult issues that obviously have to be faced with regard to the finances to progress our work. And also in particular to Councillor Purvis, Callum has coordinated and led the budget review group, and he's put a lot of time and effort into that, and I think others in the budget review group have benefited from his leadership in that regard. There's been a considerable degree of scrutiny of this paper, and I can't overemphasize actually the thanks that should be given to Callum for actually taking the lead with regard to this. So at this stage, we'd like to ask Jane and Callum if they would like to perhaps pull out the key points that they would like to present this afternoon.
Thank you, Chair. I'm very pleased to be bringing forward the 3-year financial plan for core health and social care services this afternoon. I should note that it is one part of our budget, and we will bring forward financial plans for the remaining aspects of the delegated services to the June meeting. The plan before you today sets out in detail significant investment in pay, price and demand pressures over the 3-year period. It sets out significant service developments, many of which have been mentioned in the previous paper, in line with our ambitious plans to change services across our pathways. And it sets out a significant programme of transformation and savings. It also sets out the very positive settlements that we've had from both parent bodies. The development of a 3-year plan is a major step forward and whilst we have a gap over the 3-year period, it's essential that we understand the scale of the gap, and as we are planning our services and as we're refreshing our strategic plan, we have at the forefront of our mind the need to be very radical in our service delivery, because without that, financial sustainability will continue to be a significant challenge. We've brought forward detailed executive summaries, our aim to be open and transparent around the pressures, investments and the savings. In terms of 1920, we do have a gap remaining, a gap of 2.8 million. Our discussions with NHS Tayside have still to conclude and should reduce that gap. However, we move into the 1st of April with a gap, and we will be working hard with our new Chief Officer to bring forward all options through the IJB to close the gap. Those options will include accelerating the savings that are in the plan for years 2 and 3. They will include working closely with IJBs across Tayside to look at commissioning opportunities that can bring forward further savings in this financial year and future financial years, working with other services across Perth and Kinross Council and NHS Tayside to look at efficiencies in pan-department that can be brought forward. And we have the experience of the financial recovery process that we've been through in 18-19 to build on in terms of working to look at all options that can be brought forward. In close working with the parent bodies, we recognise our responsibility to live within the resources that are being made available to us, and we'll work with the BRG group moving forward to bring forward further proposals to the IJB.
Thank you very much. Jane, Callum, would you like to add?
Thank you, Jane. Thank you, Chair. I gave quite an extensive update in terms of what the BRG had been doing to help scrutinise and microphone's not doing very well today, and inform the proposals that are being brought forward today. I'd just like to say, firstly, thanks to the officers for their efforts in supporting that process. bringing us the information, both as the proposals of savings and investment that they brought forward, but also additional information that we have asked for to help us inform our view on the. Also, we'll try another one. I'd also like to thank members of the BRG. I really don't want to hear what I've got to say today. I'd also like to thank members of the BRG, the voting members of the IGB, for their time and effort in helping support the budget process. I think, as Jane has outlined, it's very positive that today, for the first time, we're bringing forward a 3-year financial plan with full executive summaries, so that we can plan for the future and make the investments that we need to do now, but also that will demonstrate the need. The need for that is demonstrated by the savings that we can generate in the years 2 and 3 from the financial plan. So I think that's a very positive development, and also the full and detailed executive summaries looking at the Perth and Kinross Council and other councils as a model of best practice for presenting that information, both for the assurance of board members in terms of the proposals that are being put forward, but also making sure that the public are able to fully scrutinise the proposals that are being put on the table as well. I'd also like to echo the comments that have been made by Jane in terms of the support that we have had from the parent bodies, particularly in terms of the budget offers that we've had. While yes, we still do have a gap, NHS Tayside, the current indications are that they will pass on the full cash uplift that they have received from the Scottish Government, but also significantly we're receiving an 11% cash uplift from the council, despite the fact that the council has had a 2.1% cash reduction to its budget, which has obviously meant even greater savings and a reduction in budgets in other areas. And I think that I can speak for all board members to say that we are very pleased to have received that offer, and I think that shows that the council is very much committed to supporting the Health and Social Care Partnership. So I'd just like to put that on the record. In terms of the budget proposals that we're bringing forward today, there are some quite exciting and radical investment proposals that are coming forward that Hamish has spoken to in the report earlier on the Older People and Unscheduled Care Board. And I think it's really important that while some might suggest why are we looking at making significant investments when we still have a budget gap, the key point is that we are going to have increasing demand pressures, both in terms of an ageing population and also the complexity of care, which are going to continue for many years to come. So we need to be able to, while delivering better outcomes for service users, we need to be able to generate savings at the same time. So I think it's very important that we make those investments now, even if that does require us to look at some new and radical and more innovative ways going forward. And I hope that some of the proposals that officers will be bringing forward in future, along with working with the new chief officer, will be able to address the current gap, while also making sure that we continue to provide high quality services for people in Perth and Kinross. So I think that's enough. But happy to take any questions on the BRG process if people want to ask.
Thank you very much for those points and that summary. Are there any questions or comments anyone has with regard to this paper? Eric?
Can't let everybody off scot-free. I wanted to just focus on the very final point in Jane's report, which references the risk-sharing agreement between NHS Tayside and Perth and Kinross Council. Clearly, the direction of travel here for the IJB is to endeavour to provide care to people at home or in a homely setting, rather than in acute hospitals. That will predominantly result in increasing pressure on services provided by Perth and Kinross Council, and not so much, I would suggest, in terms of services provided by NHS Tayside directly. And so I'm acutely aware that the financial pressures are on the social care side in general more than the healthcare side. So it's important that the risk sharing agreement reflects that, and I just wondered if we can receive some sort of interim update on how these discussions are going.
Gina, is there anything, Karen?
Thank you, Chair. So, Councillor Drysdale, the risk sharing agreement is actually agreed. The area of concern is that the Perth and Kinross risk sharing agreement differs in wording from that in Angus and Dundee, and it's quite simply a matter of one word. In Angus and Dundee, the risk sharing agreement states will contribute, whereas ours states may. Now, given that the very generous 11.2% increase in the budget to the Health and Social Care Partnership this year, two things. Firstly, I would struggle to take to elected members in Perth and Kinross Council a suggestion that Perth and Kinross Council should indeed contribute even more of their budget into health and social care when we have no locus of control over certain elements of activity. And secondly, I think that there needs to be a discussion, and I have agreed with my fellow Chief Execs, including the Chief Exec of NHS Tayside, that we need to have some discussion about the levels of assurance we each have, collectively and individually, about the hosted services.
Thank you for those comments, Karen. That's helpful. Colin, did you want to?
Thanks. I think maybe a comment and a question. The first point that I wanted to draw attention to, it's been mentioned, but I just wanted to, in particular, to draw attention to the fact that although we're not looking at the entirety of the budget here, and that there are still health budgets which will need to come back, as has been mentioned, to later meetings of the IJB. We are, before the end of the financial year, setting a budget for the following financial year, but we're also setting indicative budgets for the second and third years. And the change from setting I think it was June last year when we set last year's budget, so 3 months into the financial year, I think the step change that we're seeing now by setting the budget, by having gone through the process of issuing the requisitions to Perth and Kinross Council and NHS Tayside, having received the offers back, and then having moulded those into a budget for the first year, but also for the second 2 years. That step change in the level of financial planning is very, very much to be welcomed and commended. I think the comment / question, if anybody wants to take it up as a question, they're welcome to, otherwise I'll just leave it hanging in the air as a comment, is that while we are looking now at a 3-year financial plan, and we were hearing earlier about the update to our 3-year strategic commissioning plan, so much of what the Health and Social Care Partnership does is, or we are trying to do, revolves around early intervention and prevention. And in terms of healthcare and some of the conditions that the Health and Social Care Partnership are managing, we actually need to be taking a much longer term look at what we're going to do with the chronic conditions that our patients and service users in some cases can be living with for certainly more than the 3 years of either a financial or a strategic commissioning plan. And we need to be looking at the overall health and well-being of the population of Perth and Kinross for 5 and, I've made the point before, but for 5 and 10 and 15 and 20 years in the future. And that some of the investments that we've heard, that some of the investments that we're making now will bear fruit in year 2 or year 3. In actual fact, there is also a much longer term issue where we could be making investments now that will bear fruit in terms of financial savings and significantly improved outcomes to our patients and service users in 5 years and 10 years and 15 years. And I think as we move forward with the development of the next version of the Strategic Commissioning Plan, what we will need to bear in mind is that we need to take that longer term strategic view, and that the 3-year plans that are recommended to us, you know, in terms of the guidance that we get from Scottish Government or wherever, are not the be all and end all, and are not sufficient to provide for the longer term needs of of the people of Perth and Kinross.
We would have an opportunity and workshop, you know, with regard to the next strategic plan to consider some of these points, looking into the future past the 3 years. Any other final comments with regard to the paper? No. We have 6 recommendations. Are you happy to accept all 6 recommendations? Yes?
Yeah.
Okay. Thank you very much. I think it's really helpful to have got to this point. Kind of enables us to move forward. Still obviously a lot of work to do, but thank you for all the contributions that have been made to kind of completing the paper today. Takes us to item 6, which was with regard to board membership. Scott, would you like to update us on some of the changes?
Yeah, the report's really just for members' information. You know, it gives some updates in terms of both the voting and non-voting members of the board, but it also makes a proposal you know, regarding the position going forward with the additional members of the board, and also an appointment to the Clinical Care and Professional Governance Committee. So the recommendations are set out to that effect.
Thank you very much. And to thank Dr. Carey for his contribution to the board, and to Fiona Fraser for her contribution. That was quite quick, wasn't it? Before we finish, there are a couple of things I would like to just note. Firstly, unfortunately, Dr. Noble isn't with us today, but today would have been Alistair's final meeting with us. Alistair has contributed to the IJB from the outset. He was asked, I think at the time, because of his reputation, his work that he had taken forward as a GP and as a retired GP in the north of Scotland, with regard to the particularly contribution of community hospitals, the relationship between community hospitals and acute care, and supporting people within their local communities. He was obviously a great advocate of that, and constantly, I've only been a member of the IJB here for a short time, but I've known of Alistair's contribution, and he is continually reminded us of the importance of delivering services within localities, and actually building from the data that you actually have. And it very much would tell us that they've got a lot of data, and to use that data effectively. And his wisdom and the support of the IJB has been very much appreciated. And he's also been an advocate for Perth and Kinross IJB and the services that have developed here, I think, across the country. He's told others of the work that's been undertaken here. So it's unfortunate he's not here. We have a gift token for him. I have it here. Thank you very much. Obviously not presenting it to anyone, but I'm going to ask Val if she could send it on to Alistair. He had wanted a gift token to get something for his garden. I think he was going to buy a rhododendron, and Rob carried out some research and wanted just to advise Alistair. Maybe Alistair would know all of this anyway, but if you go into the website at Glendoick, there are over 400 varieties of rhododendron. So it might take him some time to just come down on one. But I hope when he does choose one and he plants it in his garden and it flourishes, that he'll remember us fondly. And certainly we'll remember him fondly with all the work that he's helped us with and taken forward here in Perth and Kinross.
I can advise you actually that he has sufficient to buy 2.
Oh, he has sufficient to buy 2.
And 1 for social care.
Okay. Actually, there was one bit I forgot, and it leads me nicely on to the second part of what I was going to say, where apparently Alistair was responsible for Rob, or partly responsible for Rob becoming the chief officer. I think Rob wrote that, so he maybe needs to explain that a bit more. So we have something else to thank Alistair for. If thank's the right word, yeah?
Well,
yeah,
thank
it
you.
is. Yeah, it is the right word. So, second thing, it's Rob's final meeting actually today. Although he's still with us for a few weeks. Yeah. So I'm sure there'll be other opportunities for people to say a number of things, nice things about Rob. I'm sure there'll all be nice things about him, and particularly on the 26th of April, if people are able to come and join the celebration of Rob retiring. You probably all do know that Rob trained as a chartered physiotherapist. It's his professional background. Always very helpful. I don't know why you haven't been helping some of the older members of this board, actually, in terms of... and he began his career in the northeast of England and became the head of physiotherapy at the University Hospital in Newcastle. And when he came up to Scotland, he went to Fife as the first AHP manager, and he did continue in that role practicing. Are you good at it now? No, he did continue practicing, particularly as a specialist in soft tissue and joint disorders. And after being seconded to radiology, he moved to Edinburgh and worked as an HPA manager, but then joined the New Midlothian Health and Social Care Partnership as the head of health, and came to Tayside, and has been here in Tayside since 2014. He was the HP director when we moved to Tayside, and then obviously came to Perth and Kinross as the chief officer in September 2015, at the point of obviously the preparation for the Health and Social Care Partnership. And Rob has led the partnership to the present time, and also the support to the IJB. I've only been supported by Rob for a few months, really, as the chair of the IJB, and I'm very appreciative of Rob's support and the role that I've had here. He's such a nice man, actually. He's such a gentleman and a gentleman, actually, and he's always very attentive. There's someone come to comfort you in case you get too emotional here, Rob. But hello, Sue. You're going to have more time with me?
Yes, it'd be nice to become reacquainted.
That's good. But he is such a gentleman, and he's very attentive. He's always wants to make sure, certainly in supporting the chair, and I know other board members, that they have the information that you need, certainly for coming to formal meetings, but also just generally, and keeping us up to date with the developments in the IJB. What's really important, someone in a senior role, is that they keep you kind of very up to date if there are any key issues. You know, you need to know these things before they hit anywhere else. And Rob is extremely good at that. This was very late in me doing this, Rob. Indicating that they're saving them for the end of next month. But I did ask Rob about his time here with the Health and Social Care Partnership and supporting the IJB, and maybe I shouldn't say this, it's still being recorded, I guess. Maybe this is a point in the afternoon where kind of the camera should be switched off, or the recording device. But he said he survived, and actually, I think for anyone who's worked in a very senior position in public sector or perhaps anywhere else, it maybe does feel that you've survived. And I know, Rob, there will have been very many positive aspects to the work that's been taken forward here, and that's absolutely clear in the services that are developed in Perth and Kinross, and the support that's provided to people who are vulnerable within Perth and Kinross, that are delivered through the Health and Social Care Partnership. But in terms of the pressure that there's been, it probably does feel, when you get to this point, that you survived, and you should be congratulated on surviving, and to be proud of the work that you've actually led here in Perth and Kinross. And you know, I'm sure your senior colleagues and all the staff within the Health and Social Care Partnership will be appreciative of the support that you've given them over the 3.5 years that you've been here. So there will be many opportunities for people to say other things about Rob. Rob is the chair of the IGB, I would like to thank you very much for the support that you've given to the IGB to enable the IGB to carry forward its work. I do hope that you find lots of really nice things to do once you retire from this role. I'm sure you will, and I would want, on behalf of all of your colleagues here in the IGB, to wish you every success and happiness of whatever you do into the future.
Thank you, Robert.
And Colin has a gift, a civic gift on behalf of the council they would like to present to you.
Oh, Colin, thank you very much indeed for the Ribena.
That's another thing. I don't know what this other thing is. I shouldn't shake things, should I? In case it's a fragile thing.
That's lovely. I think it's a mini boxing ring.
Now's your opportunity to say whatever you would wish to say.
Thank you. So I actually can't believe that I've come to this moment, because it is almost exactly 4 years to the moment that I went for dinner with a dear colleague, John Walker, who's now not working with us here in the council. But John, for me, was an inspiration. He was the guy who kicked off in the shadow years the work with the Integration Joint Board in the beginning of the Health and Social Care Partnership. And John and I went for dinner at the Italian restaurant just up the street here after one day. And I'd become quite friendly with John because I was working on the clinical governance framework for IJBs, and I'd really struck up a relationship with John that was unlike any other relationship that I'd struck up with the IJBs here in Tayside. And John sat over the table from me and he just said, "Rob, by the way, I'm not going for the job." And it was as if somebody hit me in the chest with a big heavy thing, and I thought to myself, well, what does that mean? Because I'd actually become so attached to the work that was going on here, and feeling so strongly about the relationship that I had as a citizen of Perth and Kinross, as an opportunity maybe to build on what I'd done in Midlothian, and then to take that to the next level. But I didn't really have that level of belief in myself that I could do this, because I'm a clinician by background, and doing a job like this is very, very different. So anyway, I thought about it, and Sue and I talked about it, and I just felt I should put my hat in the ring, and there were several people in for the job, and this is where Alistair Noble came in, because he was the chair of the panel, and it was tough. I think we had 3 or 4 psychometric exercises, tests, and various other things that we had to do to work out, on the basis of Alistair and Sandy's information, what the key themes were for Perth and Kinross and its population. And so I got my way through the interview, and it was 12 people on the panel. I'd never been to a bigger interview. And I came out of it, I was literally shaking. And I was walking across from Puller House, where the bus station is, to the cafe where I met Sue for a bowl of soup, and I could barely eat my soup because my hands were shaking so much. Anyway, then Alistair rang me up and he said, "You got the job, well done," and then put the phone down. So there was something about applying for a job at this level. If you don't really seriously want it, you shouldn't apply. So I felt this duty to carry on, and the privilege of being given this job. And I suppose I spoke with my chief exec in the NHS at the time, Leslie McClay, and she said to me, "Rob, you'll feel like you're working left-handed for a year." Well, it's actually felt like working left-handed for 3.5 years, because this is a job that never stops. There isn't a moment in the day that you don't think about it. And the bottom line is this, that we have the opportunity to serve the people here in P&K and do what's necessary for everyone. And we lived that in our family when my dad had a stroke and had his care in our system. And I have to tell you, it was fantastic. So for all that we have difficulties and we have challenges to face, the quality of the service that people meet on the ground is exemplary, and I'm very proud of that. So I've played a small part in this. But there comes a time when it's a time to move on, and I felt that coming some time back. And the opportunity came because I am of an age now where I can choose to do something different. And I don't think I will stop working, but for this period in time and for this job, it's time to hand the baton on. This is neither a sprint or a marathon. It's a relay race. And actually, I'm very privileged to be able to hand on to Gordon, who's extremely experienced in the Care Inspectorate. A team that has worked well together. We've had our differences, but that's what team working is all about. We've had the boldness to disagree. We've had the courage to try some very difficult things. And as you will see when the inspection report is published in the middle of this year, we are by no means perfect. We have things we have yet to do. But if you look at the fact that we were able to produce 1,600 pieces of evidence of what we have done, that we have feedback from people about the quality of what is done, there are things to be proud of, and I'm very, very proud of the team that I've had working with me. And I'm ever so grateful for the support of this board. I shouldn't really say it, but there's been 23 changes in the 3 years. And with every change, we've had a new set of skills and insights and a new set of people to bring to this table a flavour of an ambition for what this should be. I'm a passionate believer in integration. I saw it working in Denmark in 2008. It changed my life from being a specialist clinician into somebody who believes in meeting the needs of the most needy in our society. And this is the opportunity this board brings. So for your part in this, I'd like to thank you, and thank you very much for the generosity of your gifts, most unexpected. And Sue and I dare say we're spending more time together in the short time. We'll have to shrink ourselves somewhat to fit in the boxing ring so that so that we can enjoy the remaining time that we have. Supporting our family, and a good bit of news, supporting our daughter. She gets married later this year. So we've got lots going on in our family this year. So thank you very much, everyone, and to you, Sue, particularly. Now, there's one person who's not here who deserves a huge mention, and that's Nikki Bell. Nikki Bell has been an amazing PA. There isn't somebody who can tolerate my chaos like Nikki, and I don't know whether she's come down, but I just want to put it on record that she came to me out of very difficult circumstances. I've absolutely loved working with Nikki. And for the whole team, there isn't one of them that I don't love to bits. And the saddest thing for me is that I'm leaving people I really like. Thanks.